Hello there, I am Dr Srishti banerjee, working as an assistant professor at LG Institute of Physiotherapy. Our topic for today is high frequency electrotherapeutic modalities in wound healing. The wound healing physiotherapy management electrotherapy point of view has two parts: high frequency modalities used in electrotherapy, high frequency electrotherapeutic modalities for wound healing, and low frequency. So this is part 1 for wound healing, where we will be looking into detail the high frequency modalities used in wound healing. So what is a wound? By definition, wound is the break in continuity of skin. Okay, it can be any type of wound: a direct injury, pressure sores, ulcers. Ulcers can be again of arterial type, venous type ulcers, infected ulcers, non-infected ulcers, infected pressure sores, non-infected pressure sores, a direct injury. All types of wound are included here. Okay, wound healing is healing of any tissue is a body's natural process. What we do by using electrotherapeutic modalities, we increase, or we can use the term, this electrotherapeutic modalities are used as an adjunct to increase the healing process, improve the time for healing process, right? So as we all know, there are three phases of wound healing. The inflammatory phase is the first phase. It sets in as soon as the injury takes place. As soon as the injury takes place, there is an inflammation over that portion. Okay, there will be getting in of histamine, and all your white blood cells, antibodies, everything get into the place. There is a process of phagocytosis and everything. Proliferative phase is when the inflammation subsides, there occur proliferation of new cells over that area. Maturation phase is binding of those new cells, increase in collagen synthesis, the strength of the scar tissue increases slowly and slowly. So these are the various phases for wound healing. Now, the physiotherapy treatment with high frequency modality is ultrasound, infrared, PEME, UVR and laser. Now, ultrasound, see, whenever we give ultrasound, there occurs a physiological effects. Okay, so the physiological effects by giving ultrasound is, first of all, it will stimulate the cell activity. Okay, if it will stimulate the activity of those phagocytes, and it will accelerate the inflammatory process. Now, why do we say that it will accelerate the inflammatory process? Because as soon as this inflammatory process subsides, sooner the inflammatory process subsides, sooner will be the next phase, sooner will be the wound healing. So ultrasound, when accelerates the inflammatory process, it is providing us to move from one stage of wound healing to the another stage of wound healing faster. Okay, that is why ultrasound is used to accelerate the inflammatory process. It will aid in skin repair, formation of new cells, so it will aid in skin repair. Wound contraction is accelerated with ultrasound. Again, it will stimulate collagen secretion. Collagen secretion will lead to an increase in the strength of wound. It will increase in the binding, or we can say the wound contraction strength. Effect on elastin properties, one of the effect of ultrasound is that it will improve the pliability of the tissue. So what happens, whenever the wound contraction occurs and we give ultrasound in that phase, it will prevent adhesion formation of the wound to the underlying tissues. So it will improve the pliability. See, the pliability is important because if the wound is adherent, okay, if the wound is adherent, it is going to restrict the range of motion. Okay, so and there are another set of complications along with it. So effect on elastin properties, it will improve the pliability, it will strengthen the scar tissue. Now see, there are two types of application for ultrasound. See, whenever you are treating the wound bed, matlab this is the wound bed. If you are treating this wound bed, you will be using a water bag method. The water is filled in a bag. The ultrasound conducting gel is applied to the surface of the bag, placed over the wound. The ultrasound conducting gel is applied between the head and the bag, and then the ultrasound is given. We do not provide a direct contact for the wound to the whenever it is applied on the wound bed. Whenever you are applying it to the periphery of the wound, it can be applied by the direct, as you can see in this diagram, a direct application to the periphery of the wound. Again, in wound, whenever you are using ultrasound, you will always use pulse mode, no continuous mode. Okay, in pulse mode we keep a 20% duty cycle, so with an intensity of 0.8 to 1.0 watt per centimeter square. The frequency is again 3 megahertz. We are providing a superficial ultrasound. We don't need to reach to the bone. Okay, so we are using this frequency of 3 megahertz. The duration is 5 to 10 minutes. Okay, this was all about ultrasound. Now, infrared radiations. Infrared, as you can see, these are this is a lamp. This is the infrared lamp. Okay. What will happen? Infrared radiation is a superficial heating. What will it provide? It will increase the localized temperature. Increase in localized temperature will facilitate the blood circulation. This facilitation of blood circulation will facilitate the metabolic activity and improve the circulation. Okay, this improved circulation will provide an increased metabolic activity. All the metabolites are flushed out, a better blood supply, better healing. Okay, IR is used in treating chronic wounds. Now, no heating modalities is ever given in acute wound. Whenever you hear a heating modality given for wound, it is always given in chronic wounds when the inflammation subsides, or else it will exaggerate the inflammation. Okay. Now, pulsed electromagnetic energy, it is very useful in treating chronic wound. It heats the superficial tissue. Now, one important point here is PEME increase the fibroblast proliferation. Fibroblasts are those cells they are the precursor cells for collagen formation. Fibroblasts are the cells from which the collagen is formed. Okay, so it again increase collagen formation, increase in the strength of the tissue, and obviously it improves the perfusion. Again, the same thing. The metabolite are washed out, and the fresh oxygenated blood is given into the tissues whenever we are using this kind of modalities. Now, in acute condition, the mean power of less than 3 watts is used, and shorter duration pulses are used with a higher repetition rate. 10 minutes is probably sufficient for acute wounds. Subacute condition, the power ranges from 2 to 5 watts. Okay, as the condition becomes less acute, you can use a wider long duration pulses. Again, the treatment time is 10 to 15 minutes. Chronic condition, very important, very beneficial modality. The power is 5 watts. Okay, pulse of longer duration are used, 15 to 20 minutes. Okay, researchers have found that 15 to 20 minutes is the appropriate duration. You do not require more than 20 minutes of treatment. Okay, so again, here we go. Ultraviolet radiations. Ultraviolet radiations are a gold standard form of treatment in open and infected wounds, specifically in the pressure sores or ulcers which are infected, also in surgical wounds. Okay, the physiological effects, again, it stimulates the epithelial cell proliferation, increases the skin condition by improving the blood supply. This is the only modality which can prevent and remove infection. Okay, there are again 4 doses. E4 directly over the infected wound bed, E3 over the indolent wound, E2 healing, it can be given over the healing wound bed and even over the edges of the wound. Now laser. Laser is a very important modality in the maturation phase or maturation and proliferation phase, because it has a activity at the mitochondrial level. At the mitochondrial level, it increases the mitochondrial activity. Increase in mitochondrial activity will lead to increase in ATP production. Okay, again it increases the macrophagic activity, which leads to an improvement in immunity. It will combat infection. It again enhances the collagen synthesis. Now as I said, increase in fibroblastic activity will lead to increase in cell production, that is collagen. Enhance in protein synthesis. Protein synthesis is very much important in the phase of healing, and again it will enhance metabolism by increasing the level of perfusion. Now there are two methods of application of laser. See, whenever you are using it over the peri-wound area, okay, we are not directly using it over the wound bed, then you use this contact technique. Okay, as you can see, this is a contact technique. As you can see, this dotted line, this dots, this is where the laser probe is applied, and between these two dotted line there is a distance of 2 centimeter. So alternate application at a 2 centimeter distance. Okay, now what happens is, and this, see, it is this is the wound margin, right? So this point of application should be at a distance of 1 centimeter. Okay, the dose is 4 joule per centimeter square. Okay, or it can be 0.5 joule per point. Now you have to mark this while giving treatment. You will be treating them alternatively. If on the day 1 you are treating these dots, so on the day 2 you will be treating this plus. Okay, that is how the treatment is given. Now the non-contact method is something like this. You use this method. Okay, this is known as scanning technique. The probe is held, see, it is not directly placed, but it is given in this fashion. Okay, by non-contact. Okay, we have to move the probe in this direction and in this direction without the contact to the wound bed. Now hyperbaric oxygen therapy, very much effective in treating burns or in treating skin grafting. Researchers have found that when you can give 100% oxygen at 1.5 atmospheric absolute pressure, it will stimulate fibroblast proliferation, keratinocyte differentiation, and it will promote neovascularization. What is neovascularization? For example, this is specifically important whenever a skin graft is taken. So when the donor graft, when placed over the recipient side, the graft will only and only adhere if the blood vessels are formed in between the recipient and the donor graft. So hyperbaric oxygen therapy stimulates the formation of these new vessels. That is why it is known as neovascularization. Again, it prevents infection by oxidative killing of the microorganisms. See, this is a chamber. Okay, whole body chambers as well as limb chambers are available. The dosage is 100% oxygen at a pressure of 2.0 to 2.4, 90 minutes once a day. It is very much effective in skin grafting, problematic wound which is not healing. Oxygen will help in formation of new blood vessels, differentiation of keratinocytes, which are very important in wound healing. Again, it is helpful in refractory osteomyelitis. Osteomyelitis is infection of bone. So this was the end of part 1 of use of electrotherapy in wound healing. There is part 2, which is low frequency wound healing modalities, that we will be seeing in the next part. Thank you.